Great, thank you, Tara. So I have the pleasure of working with Dr. Mousel to present this, this content today, so calf care. So the topics we're going to cover are going to be colostrum, which is what I'm going to present about, and then we'll get into getting calves to nurse as well as grafting calves, which Dr. Mousel will elaborate on. So without any further ado, oh, I always forget this part, but I wanted to share a quick story with the group. When I was doing my master's degree, I did several projects. The last one was with extension. And in that project, I had calves from day 0 to 80. We had 80 calves, and we were looking to see if there was a difference between a probiotic and a conventional starter. So we had an experimental group and a conventional group, monitor from 80 days for growth parameters and health. And when we got to the end, there wasn't a difference between the two trials, and we wanted to know why. So we looked back at the data we collected, and one of the numbers that jumped out to us was serum immunoglobulin levels, so how much colostrum they got at birth. And they were really high levels in both groups, which really stressed that both these calves were really set up for success by a phenomenal calf care program that, like, the keystone of which was colostrum. So these calves got high quality colostrum right off the bat, and that impacted their health for days and months going forward. So for me, the takeaway was quality colostrum in a timely manner has huge impacts on calf health, which is why I wanted to talk more about colostrum and its impacts on our calves. So the way I'm going to do this presentation is we're going to start prepartum, she has her calf, and then postpartum. So in prepartum, what we want to consider really is the calf and her health. I'm sorry, the cow and her health. We want that cow to be healthy, to have all the nutrients that she needs in order to be strong and healthy. So that is the nutrients that she needs, both vitamins and minerals, as well as a quality, a high enough body condition score. And we want that around 5.5 so that when she has her calf, she can take care of herself, but also produce good quality colostrum and high quality milk for that calf. So that's really important, having a healthy cow for that calf as well. So with our colostrum, it's important that it starts building and depositing 5 to 6 weeks before parturition. So it's not simply the day of she's going to have her cow that colostrum starts happening. It's a building process, and that requires quality nutrition for a cow throughout that process. Another thing to consider is if you're going to do a scours vaccine, you need to account for that before she has her cow. So we're looking at about a month ahead of time. It depends on the vaccine, of course, but making sure that you account for that she gets that vaccine in a timely manner so it has time to be effective and be effective for the calf on the other side. If you want to change your feeding times, you can look at the Cohnfeld method, which in essence is if you feed during the day, then your cow calves at night. And if you'd like, we can talk about that later, but the focus of us today is colostrum. One last thing I wanted to touch on about the cow's diet is with nutrition, you want to make sure that they're getting a quality vitamin and mineral mix so that that last trimester when she's, when that calf is developing the most, they have all the nutrients that they need. So that's calcium, selenium, all the vitamins and minerals in order to have that, to build that quality calf and make colostrum and milk on the other side. So she has her calf, everything went smoothly, the calf pops out and everything's great. So when we looked at postpartum, of course, we'd like for it to go swimmingly, but sometimes there's other troubles. So sometimes they have a fluid in their respiratory passage, like in their nose, and taking a clean hand, we wanna get that out so that they're able to take that breath. And if they're not taking a breath at that point, then we kind of have to help them along. So we want to stimulate that gasp reflex. And what I was always taught was take a bit of pokey straw and poke their nasal septum to get them to like gasp, or you could stimulate the ribs as Dr. Joe talked about last time, or you can splash water on them, anything in order to get that gasp reflex in order for them to take that first breath. I want to stress that hanging on a gate is not a suitable way to encourage them to breathe. What's actually doing is taking their digestive tract and it's pressing on the diaphragm, making it harder for the calf to breathe. So use the methods that I talked about before with the straw or rubbing the ribs or a splash of water to get that gasp reflex, that breath, rather than the over the gate. That's not a way where we want to stimulate that breath. So with our calf, we want a healthy calf that hopefully nurses off mom and receives colostrum. So why is colostrum so important? And I'm going to talk about that next. So I really like this graph because it's so, I think of it as succinct. It's how much does she absorb? How much does that calf absorb over a period of time? And the part that I've circled is where the most absorption of those IgGs, that passive immunity is occurring. It's really within the first 4 hours and then it decreases rapidly. So what I would like you to walk away with, as soon as that calf comes out, you start to see like a ticking clock of, I have a window in order to get that colostrum in the calf, in order for her to get that passive immunity, that barrier against pathogens that she needs, but it's a ticking clock. And I need to be proactive in making sure that that calf gets that passive immunity, those IgGs, that colostrum in them. So with colostrum, we want about 3 to 4 liters within the first 4 hours of birth. And a liter is approximately a quart. So we're looking at not just any colostrum, we want high quality colostrum to go into that calf. So we're looking at colostrum that contains greater 50 grams of IgGs or greater is considered high quality. And if she's getting 4 feedings, 4 liters of 50 grams of IgGs, then she's getting around 200 grams of those IgGs to give her that passive immunity. We're trying to give the most amount of IgGs to that calf so that she can absorb it and get that passive immunity from mom. As much as we want passive immunity, we don't want to overfeed. So the way I like to think about it is giving them a turkey dinner. If you give them a full turkey dinner, that's a lot of food. They're going to get sleepy. They're not really stimulated to stand up. So we want to get that passive immunity to that calf, but we also want them to stand up and go look for mom to establish that bond and to get the rest of that colostrum, that passive immunity that we need. And I'm going to do a quick call out to the Moose Room, episode 10. They do a great job of talking about beef scours and colostrum. So if you're interested in maybe listening to it in the truck while you're waiting for those calves, that'd be some great listening. So colostrum takeaways. Who needs that colostrum? It is needed by that newborn calf. And we need them to have high quality colostrum. So 50 grams of IgGs or higher in that colostrum. So high quality colostrum within those first 4 hours to get that absorption, that passive immunity to protect her from pathogens. So preferably, we'd like for them to go to mom in order to get that colostrum. Mom is the gold standard, but if that's not going to happen, then we still need to get them that passive immunity through intubation and an esophageal feeder to get them the colostrum that they need. So why passive immunity, as I mentioned before, and how? By going to mom or by an esophageal feeder. So the last thing I really wanted to touch on was to underline the difference. So colostrum replacer is a high quality replacement for colostrum. So if we can't get mom, the gold standard, then we can use a colostrum replacer, which has around 200 IgGs per liter in order to get that passive immunity that we need. Another option would be a supplemental colostrum, which is around 50 IgGs per liter. So if it's a heifer and her milk hasn't really come in, or if it's a cow that didn't put on the body condition score that we wanted, so she's not making high quality colostrum, so low or medium quality colostrum, then we can mix that with a supplemental colostrum in order to get the whole package of passive immunity for that calf. So those are different from milk replacer. Milk replacer is a quality product. So it's providing protein and fat and vitamins, but it's not providing that passive immunity, those IgGs that we're looking for that calf. So when that newborn clock starts ticking, we need to get them colostrum for that passive immunity. Milk replacer won't give her that passive immunity that she needs. So with that, I will pass it over to Dr. Mousel.
All right, thanks, Dana. It's great to see everybody here. Thanks for having me on the deal here. I'm gonna just briefly cover a couple of items on, getting calves to nurse, and then talk just a little bit about grafting calves if we need to do something like that. So where I think it's a good idea to start out with is anytime you have a calf that's really not cooperating, you know, sometimes it gets a little bit overlooked to just make sure the calf is physically able to get up and suck, especially this time of year. They can be pretty slow, especially if they get cold. And so, we want to make sure that if that calf's not up in, 30 minutes to an hour, we might have some other problems that we're dealing with that need to be addressed. So it's probably a good idea to go ahead and do a temp on that calf, just make sure that it is able to get up before we start messing around trying to get it to suck when it's really not physically able to anyway. Next slide, Dana. All right, and so the other thing is we, as Dana correctly pointed out, we kind of got to keep an eye on the clock here. Even if the calf seems to be doing pretty well, and maybe it is able to get up, but if it hasn't sucked or tried to suck, within maybe an hour or two after birth, it might be a good idea to start intervening just to make just to kind of speed the process along, because at 2 to 3 hours post-birth, we're going to have to start thinking and making some decisions on using some colostrum replacer and those types of things. And I don't know, I generally think it's a good idea to try and get that calf to suck before you go to some type of replacer. Otherwise, that seems to slow them down even more because they got something in their tummy and they're not that interested anymore. And so, just kind of keep an eye on your timeline as you kind of start going through the process. Next slide, Dana. Okay, so we get to the point where we're going to need to intervene on a calf that's maybe not cooperating, or maybe the cow's not cooperating. So I think it's always a good idea to have a little bit of discussion on restraining the cow, particularly if you've never done this before. We've already had some good discussion on head catches and calving chutes and those types of things, so I don't think we need to reinvent that wheel. But I do think it's appropriate to talk a little bit about hobbles, because when you read a lot of the popular literature, there's generally a lot of discussion on hobbling cows, which is a good thing to have the ability to do if it's done properly. Next slide, Dana. All right, so, it's important to keep in mind that if you're going to hobble a cow, we got to keep a couple things here. Hobbles obviously are for the safety of you and the calf. We don't want anybody to get kicked in the face, obviously. But we also need to pay a little bit of attention, particularly with beef cows, on the hobble style and the material that it's made for, because that primarily is for the safety of the cow. And I like the picture on this slide because he's got just a nice foot tie there on that calf. So it's not overdone. He's got the cow restrained and he's able to get up in there without anybody getting kicked. Next slide, Dana. All right, so not that this is a real complicated thing, but something we want to keep in mind is just a basic foot tie. If you can get them in a head catch of some type, it's a very simple thing to do, because if you haven't hobbled a beef cow before, they're not used to being handled like that. They typically don't like it, and they can flip out pretty quick. And so, doing some type of simple foot tie, or on the right of your slide there, using a self-tightening mule twist is probably the best option for beef cows. Now, obviously, for dairy cows, there's any number of different hobble styles and material, and they're all, good things because dairy cows are used to that type of thing. They're used to be handled down in that region. Beef cows, not so much. So we want to kind of keep an eye on that. Next slide, Dana. Now, this might be a little bit of overkill here, although you do have to appreciate the knot tying ability with that much paracord. So, but we probably don't need to quite go to this length. Next slide, Dana. We probably want to think about, when we think of the styles of hobbles that we talked about, when they're in the head chute, probably just about anything will work, any material. Many of the different styles are probably just fine. The issue is more so if you turn the cow and calf out and you decide that that cow still needs to have hobbles on. We want to keep in mind on a beef cow, it's a really good idea to use only cotton material. When you get into leather and nylon and some of these other styles of hobbles that are fairly common, particularly in the dairy industry, a cow can cut herself up pretty bad. And I've seen some real wrecks with hobbles on cows out of materials that are pretty tough and maybe not the best thing to do with a pretty high strung animal. And, obviously with a beef cow, you don't always know how they're going to react. And so I think it's generally a good idea just to stick with cotton mule ties or something like that. And I know many a beef cow has been hobbled with baling twine. But generally, I don't think that's a real good idea, just in case that cow does go a little bit batty on you. She cut herself up really bad. And baling twine doesn't have a lot of, it doesn't have a lot of pulling strength to it, but it has a tremendous amount of shear force strength. So you can't always guarantee if she goes crazy that the baling twine is going to break. And so, like I say, there's been a lot of cows, obviously, that have been hobbled that way, but it's just generally not a real good idea. All right. So if we're going to teach these calves how to nurse, if they're just not cooperating or the cow's not cooperating, we want to look at, okay, is the calf just being slow? Is there another problem like we talked about on the very front end? Or we want to look at, okay, is the cow or heifer resisting? Okay. Now, in this particular scenario that we're talking about here, we're assuming that the cow's claiming the calf. So she's low and after it, she's watching it, she's trying to lick it, those types of things. But, we've all seen that scenario where the cow claims the calf, but won't let it suck for some stupid reason. She kicks at it, tries to move away from it. But if you try and get in there and do something, she starts getting pretty upset. So that's a fairly common scenario. And so next slide, Dana. Okay, so if the calf's just slow to suck, first of all, make sure it's got some kind of suck reflex. Just make sure everything's operating there. If there's no suck reflex, and this is purely observational, but they're typically, I don't know if the mom didn't lick it enough. It just hasn't been stimulated to really wake up and start sucking. So assuming that the calf's not cold, or some other issue, sometimes it can really help to just put it like on a rough out leather glove and just stroke that calf against the grain of its hair. And that really seems to wake them up. And if you do that for a little while, it seems like they'll start to get a suck reflex pretty quick. So anyway, it's just a little bit of a stimulant to try and get that calf going a little bit. Next slide, Dana. So if we're if we're getting to the point where the calf is ready to suck and the cow just won't accept, it claims the calf, but she's a little bit antsy, doesn't want to let it up in there. We want to restrain the cow. if we have that opportunity. We may need to hobble her if she's a kicker. And then I always think it's a good idea, if you got them caught up, just go ahead and wash them up a little bit. Because obviously that's where a lot of our scour vectors are transmitted, is right there on the udder. And then I think it's generally a good idea just to milk her out just a little bit, make sure the milk's come down, make sure she has some, and then get a little bit of that smell on the teat and rub a little bit on the nose of the calf, and then just manually get the calf up there and see if it will figure it out. And it probably will take it could take quite a while. It doesn't always. Sometimes the calf gets right in there. Sometimes it can take a little bit of time, and you just repeat that process until she lets it. And typically within a few hours to a day or so, she'll let that calf in there. Next slide, Dana. The other thing is that you do tend to run into once in a while is if, obviously if you try to milk her out a little bit, which is kind of why I recommend doing that, and there really isn't much, do you have an issue there? It might be helpful to give her a little bit of oxytocin to help let that milk down. And that, that may take about 30 minutes to really let that activate. I do think, a lot of the old ways of massaging udders and milking repeatedly and those types of things, they work fine, but that can be a little bit of an issue with beef cows that aren't used to being handled. So, if you're comfortable doing those types of things and the cow seems to accept it, that's fine. But I don't want anybody getting kicked in the face either. So, just kind of keep in mind that part of the situation once we get her caught up is let's make sure that she does have some milk in there. Dana, next slide, please. All right, now what if the calf's ready to suck, but the cow or heifer is just resisting? And obviously you see this in heifers fairly frequently. And I think it's really a lot of times just a situation where maybe she's a little sensitive in the udder, the teat, maybe it's sore, maybe it's froze. There could be a number of things going on there. And she doesn't want the calf in there fiddling around. You can have some really aggressive calves that can really beat her up. And if it's a heifer, she's not liking that very much. And then the other thing is, is for some reason is the cow just not letting the calf get in there. She claims the calf, but she keeps stepping away from it, keeps headbutting it away, whatever the situation is, kicks it. And so that's kind of what the couple of scenarios that we need to look at there. Dana, next slide, please. So if we look at, start out looking at if she's just a little sensitive, go ahead and just kind of repeat steps 1 through 4 there, like we talked about before, and just see what's going on. Make sure that she's actually got some milk. Obviously check the bag for is she cut up? Is it froze? Is it caked with mud? Is she trying to kick you if you're in there fiddling around, or is there something else going on? And then, once you kind of get through that little checklist, just get the calf in there and let it suck and see if she will, number one, if she'll let him do that without being hobbled or anything. And if she doesn't, put the hobbles on her and just let it get in there so she kind of gets used to that feel. On heifers, on cows, cows that do this are fairly rare, but it does happen. And I don't really know why. But sometimes it just takes a little bit of time for the hormones from the birth process to dissipate. Obviously, some cows it takes longer than others. So if you feel like you need to get the calf in there and sucking and she's not letting it, go through the process, get the calf in there and let it suck. But chances are, once the calf has been in there sucking, several hours go by, she's probably going to be just fine. Dana, next slide, please. If she's really resisting, if the cow is really resisting, steps 1 through 4 again. And the best I can tell you is you're just going to have to repeat this until she lets the calf do it. And that can take a couple hours, maybe a couple days. It's not quite the same as if she doesn't claim the calf. Usually they come around quite a bit quicker in this type of scenario. but sometimes you just never know. And so you just got to have some persistence, stick with it. And, most of the time, well, a great majority of the time, that cow will eventually, or heifer will eventually let that calf in there, and it's going to stop its antics. Dana, next slide, please. So again, as Dana correctly pointed out on the front end, keep an eye on the stopwatch. Just to reiterate a little bit, once we get to about 4 hours after birth, we're going to have to start thinking about some supplemental colostrum. And in a situation where that you're having some issues that can take longer than just a few hours, we may need to supplement some milk replacer in there just to keep that calf full, particularly if it's really cold out. You don't want to stuff them so full of milk replacer that they're not interested in nursing, but you don't want to get behind them either to the point where they start getting chilled, circulation starts to suffer, those types of things. And, just repeat that process until the calf sucks on its own and the cow will let it. Dana, next slide, please. All right, now grafting calves, obviously this is a little bit different situation because now you're trying to get a cow to claim a calf that's not hers. Generally, this is not too big of a process if you kind of understand the concept and kind of pay attention to some of the details. And so sometimes it's recommended to start off with a little bit of oxytocin just to kind of get everything going. And we're talking, a situation where she's freshly calved and maybe she lost the calf. And so it's still pretty fresh. And we've got some type of orphan that we're going to try and graft onto her. And so Canadian research has shown that 50 to 60% of cows in this particular situation will accept an orphaned calf without any intervention, which is an interesting thing. And so there's always a lot of products and things that are used to graft calves. And, the Canadian research shows that at least half the time that's really not necessary. Of course, the problem is you don't know which cows are going to go ahead and claim that calf anyway, and which cows claimed it because of something that we did. So typically it's a good idea to, once you go ahead and prepare that cow, maybe you have the opportunity to smear some fluids from the birthing process, some afterbirth all over that orphan calf, and leave them together for a little while and just see if she pays any attention to him at not before you really get into some of the other opportunities that there are to graft calves. Now, obviously, if she's acting like she's going to hurt the calf, you don't want to leave them together. But at least in my experience, that's been pretty rare. Typically, she'll just ignore it. And if the calf comes near, she'll just step away from it. But once in a while, they can get pretty aggressive towards a calf that they don't accept, and you need to be aware of that. Dana, next slide, please. All right, now when she doesn't claim her calf, we're going to need to make sure that if the orphan calf is a new calf, also a new calf, we're going to need to make sure that we're setting that calf up for a long process of being grafted, because sometimes this can take several days to happen. And so we want to make sure that the calf is getting its proper nutrition, and that the calf is safe, obviously, before we in the process of trying to pair it up with a cow, and just make sure that we're paying attention to some of these things. Next slide, Dana. Okay, so if you kind of go through that initial process of, you give them a little time to be together and she's just really not paying it much attention, it might be a good idea to go ahead and restrain the cow and let the calf suck, and give the cow an opportunity to let that calf in there, and see if she's going to start kicking at it or not. Then we've got an opportunity maybe to try a calf claim powder, which obviously is just a substance, a commercially made substance that provides a very strong, not very pleasant smelling scent that you can smear over the calf and then stick it up in the nose of the cow and see if you can fool that cow into thinking that the calf smells like what she thinks it smells like. These calf claim powders, they do seem to work a good number of times. You can also try something as simple as, like Vicks Vapor Rub or a really strong smelling vanilla or peppermint or something like that. Just do one or the other, not both. But that's generally a good way to at least start the process of trying to pair up that cow and that calf and see if she will pay any attention to that. Dana, next slide, please. All right, and so if we do get into a situation where the cow has just lost her calf, and you've got another calf that's a little bit older that you're trying to graft on, it may give us an opportunity to skin out that dead calf and drape the skin over the orphan to see if we can fool her into thinking that orphan is her calf. It's a fairly simple thing to do. It's a little bit time consuming. You got to make sure that the skin is secured very well, because if she does take to it, she's going to lick it a lot. And it's pretty easy to peel them skins off if they're not secured very well. So, either with twine or duct tape, we may need to make sure that it is secure, not tight, because the calf's going to have to wear it for a while. And we don't want a situation where if we use twine or something that it's cutting off the circulation or it can get wrapped up in it. We just want it so it doesn't slide forwards or backwards or off to the sides or anything like that, because she's going to work it over pretty good if she kind of follows that scent around, and we want to make sure that it stays on there. Dana, next slide, please. So that's a pretty typical look at a skinned hide on a calf. Now, there's a couple things to point out there is when you skin them out, you want to get the tail because you want to cover as much of that rear end as possible because that's where she's going to lick the most. That's where she's going to smell the most. And so we want to make sure that we've got enough hide from our skin to cover that area. And then notice that this particular skin in this picture, it's skinned all the way down to the fetlocks. And again, it's really just about creating as much surface area as possible. And so I guess what I'm getting at is, don't be lazy when you skin out the calf. You got to get as much of the skin as possible to have the best chance for this to work. Next slide, Dana. Again, keep an eye on the time. Make sure that the calf has the orphan has the nutrition that it needs. If you're not in a situation where it's getting in there to suck, then we might have to use some replacer just to make sure that calf is staying healthy. And if they aren't paired up, it may come to where you have to restrain the cow periodically and let it suck to see if it will let the calf in there without hobbles. And that's a good way to start, and then just try and progress to see if they will stay with each other without being restrained. And it might take a couple hours, it might take a week, it could take 2 or 3 weeks. It depends on how persistent you're going to be. But typically, if you stick with it long enough, that cow will eventually take that calf, or that calf is going to get smart enough and figure out how to suck on that cow without really presenting himself to her. He'll come in from behind or whatever, and she'll let him suck as long as she doesn't see him and won't beat him up too bad. And then obviously, you have to take the skin off after a while because it'll start smelling pretty bad, and so, keep that in mind. The big question always is, well, if she doesn't accept the skin, what do you do? And I would say, just as a last resort, go back to some of the things that we talked about previously. Maybe try a calf claim powder as a last effort. Repeatedly, present the calf in there while she's restrained to let him suck. And if, like I say, if you stick with it long enough, eventually the cow will let him in there, or the calf will get smart enough to figure it out on his own. And, once in a while, obviously it just fails and it doesn't work. And that's just the way it is. Dana, next slide, please. Oh, so there you go. So just a couple, just kind of keep in mind, like Dana pointed out, and that's a really critical thing, and I've said it a couple times, is, keep an eye on the clock. We don't want time to get away from us. We don't want that calf, particularly when it's cold, to get behind on nutrition. Keep it energized, but don't stuff it so full that it's not interested in trying to get up in there and suck on that cow. And persistence, and most of the time you'll be successful, particularly with the grafting process. And you just kind of got to keep after it. Don't get yourself or the calf hurt, and good luck.
Thank you, Dr. Eric. We've got quite a bit of questions here and some comments in the chat box. So if you guys are ready, I'll go ahead and we can start asking them. Just so that I know there's a lot of discussion going on about this, but so that our audience that will be watching on Facebook Live, they obviously can't see this. And for those watching the recording, can you, Dana, and maybe Dr. Joe weigh in on how can you tell if the cow has good quality colostrum?
So in a perfect world, I think you'd have a colostrometer with you in order to measure the colostrum quality. But for a lot of beef producers, that's not very realistic. So I think a lot of it comes down to, my understanding is it comes down to looking at that beef cow and seeing, like, does she have a good body condition score? Is she making good colostrum? And that's going to be a primary way that you determine whether or not you supplement, or maybe it's a routine procedure that you add. I know Troy has shared in that first video that we made that he always adds supplemental colostrum to his colostrum in order to make sure to know 100% that calf got all the passive immunity that she could have gotten. What do you think, Dr. Mousel?
Yeah, I would agree with you. Yep.
The big thing on measuring colostrum quality, like Dana said, she's spot on with the body condition. I tend to assume that there's not really a problem until I see that there potentially is. You can definitely measure every single cow if you want to, but that's a lot of work. It's a lot putting yourself at a lot of risk. So for me, I think what Eric talked about is the most important. If you're noticing a problem with the calf, then you need to check the cow's udder and make sure there's not a problem there. And then if you want to measure, I'm a big fan of the refractometer. That's my favorite tool if you're going to do it, because I need a single drop. I don't need a big volume like I would need with a hydrometer. And I can get one for about $40 to $50, and they last a long time.
Okay, Can you guys tell us how much colostrum can you safely milk from a cow to freeze for emergency use?
I will defect to either Dr. Mousel, Dr. Joe.
It's all about the situation with the cow. So if she doesn't have a calf and you're milking that colostrum out for potential use with another calf, then take as much as you can get. That would be my answer for that situation. If you're trying to get a little bit and build a little bit of a supply from cows that are already nursing calves or are going to have to nurse calves, and you don't want to take anything if you can help it. That calf that's on that cow needs that. So it's not ideal to take from that cow if you don't have to. You can take a little bit, but I really would try to avoid that if I can. There's a lot of other ways to do it. There's a lot of, if you can make some friends on the dairy side, then sometimes they have some extra colostrum, and especially if it's pasteurized colostrum, then you can protect yourself from any disease transfer or anything like that. And that's what I would recommend.
That was the very next question, Dr. Joe. And then if you want to build on that, they asked also with a bottle or tube feeder.
I will do whatever you feel most comfortable and whatever the calf allows you to do. If they'll take it from a bottle, great. That would be wonderful. Not all calves will do that. And especially if you're not comfortable tube feeding and making sure that tube's in the right place, then I would try a bottle for sure. Sometimes you're going to have to use a tube feeder. It's just the way it is. And that comes down to technique, making sure you're in the right pipe. And again, what Eric and Dana have been talking about is not feeding them too much. So they really do have a drive to get up and get nursing like they're supposed to. So whatever you can do, it just needs to get in that calf, right?
Okay. Dr. Eric, this is for you. They were told that only to use calves from their farm because in regards to grafting, because you could potentially bring in a disease from another farm that you don't have. What are your thoughts on that?
Well, that is true. It's something you got to be concerned about. I think it's a good idea. I think sometimes you don't have much of a choice. If you want to graft a calf on there, you may have to get one from another farm. But it's a good idea to have a good where that calf came from, what the health situation is, where it came from, and those types of things, because that is going to be a concern if you bring a calf in from somewhere else. Yep.
Okay. And then what are your thoughts? Do you think, do cows usually take the calf when it starts peeing her scent after they've been, nursing her milk, starts to smell a little bit more like her? Does that usually help a little bit in the grafting process?
Sure. I don't really know. It's all about the smell. It's about the olfactory nerves in the cow. And so much of it comes from the birthing fluids, the pheromones in the hair, so on and so forth. Sure, urine probably helps once the calf has cycled some of her milk through. But is that the only thing? I don't really know. Dr. Joe may know. I don't.
I tend to think that it's actually just a factor of time together, kind of like Eric was saying. It's just, you got to stick to it. You got to be dogged about it, and it's just a factor of time. And then to me, I'm on board with what Eric's saying 100% with the fluids and the birthing fluids and being able to get your hands on some of that. Remember, she's going to kick her placenta out, sometimes not right away, maybe 8 to 12 hours later. You could find that if you keep her tied up, that could help too. So I think that's where I'd spend my time. And yeah, it's just about time together. They figure it out a lot of the time just by being together enough.
Okay, what is the recommendation between colostrum replacer versus frozen colostrum from another farm? Which do you think, if you have the option of both, what would you prefer?
I personally, it's dependent on your farm and your risk tolerance when it comes to disease transfer. If you have a closed herd and you want to maintain a closed herd, you should be using colostrum replacer. If you can guarantee that frozen colostrum was pasteurized, then I'm a lot less worried about it. But it's all down to your risk tolerance for what you're willing to bring onto your farm. If you're getting frozen colostrum from another farm, freezing doesn't necessarily kill things like yonis. And that's something you need to pay attention to when you're getting colostrum or getting any animal or any product from a different farm.
Okay. Dr. Eric, in regards to grafting, do you recommend using any sort of product like ACE or Rompum to help calm them down?
Well, no, not generally, for a couple reasons. Number one, it takes a pretty aggressive cow for that to be necessary. And number two, it's such a fine line between calming that cow down and making her non-functional. And with certain products that are commonly used in that scenario, it can actually make them more wild depending on their reaction to it. So if a person really has some experience with it and knows what they're doing, I think it can probably help. But for most folks, I just don't really think it's necessary.
Sure. Okay. Could you guys, when would you make the call to tube a calf? Not sure if that's initially with colostrum or following up if they're not nursing.
Yeah, I mean it's dependent on the calf suckle reflex, like Eric was talking about. And then the ticking time clock that Dana and Eric are talking about. If you can't get to drink from a bottle, and it's been 4 hours already, and you're not having any luck with mom either, it's time to tube. If you get to a point where and sometimes, like Eric was talking about, you need to make sure they're warm and all those other things first, by taking a temp and making sure that you don't have any other issues. But sometimes part of that process is getting them calories. They just need calories to warm up. And we can greatly enhance that process by putting something warm in their belly. And so I'm tubing when I know I don't have a suckle reflex, but I have a calf that's awake enough to accept a tube. Or it's just a time factor. I can't wait around too long to get colostrum from this calf, knowing that it won't absorb those antibodies if I wait a whole lot longer. So that's where I'm at when it comes to tubing. Again, it's all technique and being really comfortable with that. And that's something your veterinarian can help you with. If you ask them to, they will help you and show you. And I'm always a fan of reaching out to neighbors and on the dairy side too. There's a lot of people in the dairy world that tube a lot of calves. There's a lot of people out there that could help you with that. So just reach out to your neighbors. I think you'd be surprised. There's a lot of people that would help you with that technique if you need it.
Here's one I think that pertains to a lot of us. What do you suggest if you don't know if the calf has drank? For example, if you are at work.
Tube it.
Yeah, I'm with Eric. If when in doubt, get it colostrum.
Just because there's so much to lose, it's better to know that they got that passive immunity than not be sure. So it's better to make sure they get those calories, if anything.
Yeah, and once it's had its colostrum, either supplemental or from the cow, and you're not sure if it's sucking very well, if you have any question at all, just put some milk replacer in it.
Sure.
Like I say, don't stuff it full so it doesn't want to, follow the cow around, but don't get behind it either. If it has been suckling and you give it some milk replacer, it's just going to be full. It's not going to hurt it otherwise.
Okay, I think that is, oh, I got another question. What type of tuber or tubers do you recommend using?
I like the one with the little ball on the end. So you have to really thread, it over the tongue, over the trachea, and you'll know when you hit the esophagus because you'll get quite a little resistance going over the trachea. And then when it starts to slide smoothly down to, over halfway of the tube, then you know you're in the esophagus. If it's resistance all the way, I'd probably start over because there's a good chance you might be in the trachea or something else weird is going on. Once you get over that trachea, it should slide real smooth. The tube all the way down to the bottle.
Yeah, I think the most important piece is that ball. And I like a pretty decent sized ball on there because I can actually, on the left side is where the esophagus is, and I can see that ball. And because of how the structure of the trachea is fairly rigid. It has rings, cartilaginous rings that travel all the way down. So when you go in the trachea, you will not see that ball at all. But when you have that ball on there and you go in the esophagus, you'll see it pass along the left side of the neck. And I know where I am. After that, it honestly doesn't matter. My big sticking point with those is to calves chew on them constantly when you're trying to tube, especially when you're new at it. You need to be checking to make sure it doesn't have any rough edges and it's not cutting up the back of the trachea, because that's where we end up with things like diphtheria and other stuff like that. And I've done a couple surgeries now where calves have actually bit through the tubing and they swallow the entire, esophageal portion of the tube. And then I got to go in and find it. And that's not a great surgery. It's not a great way to enter the world when you're only a few hours old. So just maintaining it is kind of the big piece. After that, if you want to use a bag or a bottle, however you want to make it work, that's fine.
Okay, thank you. I'm not seeing any further questions in the chat box. So I think with that, I'll go ahead and turn it over to Tara.